Did you know that nearly 1.5 million unvaccinated children die every year from preventable diseases according to the World Health Organization? Polio, measles, hepatitis, tetanus, and smallpox. These life-threatening diseases are ready to cause the next epidemic. Fortunately, nationwide and global efforts to vaccinate the population have suppressed these diseases. Having benefited from many vaccines myself, I've experienced firsthand the positive results associated with immunizations. Along with this experience, I have conducted extensive research to conclude that the advantages of vaccinations outweigh the risks of choosing not to vaccinate. The choice to vaccinate affects us all and can be the difference between life and death. We will discuss how vaccines save countless lives, protect future generations, vaccine safety and effectiveness, and the importance of disease prevention through vaccination. First and foremost, vaccines save lives of those who may be exposed to the disease and protect the health and well-being of those who may not be able to be vaccinated. As mentioned earlier, vaccine-preventable diseases cause unnecessary suffering and deaths of many each year. Protecting the health and future of our children when they are the most vulnerable is one of the most important steps that a parent can take according to the website vaccines.gov. In addition, future generations are protected by immunity as a result of these immunizations. We all share public spaces, therefore we collectively share the responsibility of public health and safety. The decision to not vaccinate puts others at risk, such as those who cannot be immunized due to age or health complications. Personal, religious, and philosophical beliefs are not valid reasons to allow the opening of diseases back to our society. Now let's focus on vaccine safety and effectiveness. Like all medical products, vaccines come with risks, and according to vaccines.gov, serious harm or death is unlikely. So what is a vaccine according to vaccines.gov? A vaccine is composed of harmless microbes that prepare the immune system for attacks, thus creating immunity in the future for the microbes. So what makes it safe? After extensive research, development, and testing, vaccines are approved and continually monitored by the FDA and CDC. Childhood vaccines have a proven effectiveness of 90 to 100%. Comparison to the millions of lives protected from diseases due to vaccinations, only a few thousand serious cases are reported annually to the CDC since 1990. So how do we know that vaccines are effective? The history of vaccine-preventable diseases speaks for itself, as disease cases immediately decline after a vaccine is licensed. For example, confirmed cases by the World Health Organization of rubella, also known as German measles, were drastically reduced by 99.99% between 1998 and 2013. Proven to be our best defense of debilitating diseases, vaccines have paved the way for immunity and the eliminations of diseases, which brings me to my next point. Vaccines eliminate preventable diseases and the costs associated with treatment. Decades ago, smallpox devastated the population, as the CDC reports that 3 in 10 of those infected died. In 1980, the disease was the first to be eradicated and was named the greatest achievement in international public health. Because eradication and elimination are achievable, immunizations are an investment. Receiving vaccinations before exposure is key to preventing illness and the costs associated with treatment. Vaccine costs in terms of finances and time are dramatically lower than the preventable disease, which may have long-term effects. While most vaccine costs are minimal, a CDC study shows treatment costs per child have resulted in the expenditure of tens of thousands of dollars. Many health insurance plans may cover vaccine costs, and for those families in need that are low income, a program offers no cost, making the process convenient and affordable for vaccinations. Today we have discussed how vaccines save countless lives and protect future generations, vaccine safety and effectiveness, and the importance of disease prevention. As parents, we all want the best for our children. From choosing the right daycare to the safest car seat, vaccinations are no different in regards to prioritizing safety. I strongly urge you to protect yourself and your loved ones by ensuring that your vaccinations are current today. Be part of a movement that selflessly chooses to vaccinate, saving millions of lives in the decades to follow.